These are some of the most common surgical procedures in women's healthcare today. Of these, the hysterectomy is the most common non-obstetrical procedure, totaling over 600,000 performed every year. Technologies used to conduct such procedures have evolved to an impressive point. Minimally invasive procedures such as robotic surgery are resulting in better outcomes for the patient. Yet, with such advanced techniques at our disposal, experts in gynecological surgery are surprised to hear that over 60% of all hysterectomies are still open abdominal procedures.
It's surprising that there's a lot of hysterectomy still done abdominally because we have so many new technologies. Minimally invasive surgery has come a long way over the past 10 years. And there's no reason now why women should have to go in the hospital and have a 3-day hospital stay, a large incision, and a protracted recovery.
Dr. Cousins and his colleague Dr. O'Toole have been performing robotic hysterectomies and other gynecological procedures for almost 7 years using what's known as the Da Vinci robot. Seated at a remote console just a few feet away from the patient, Dr. Cousins is positioned to view the entire procedure three-dimensionally and in high definition while controlling 4 robotic arms. Each arm has a greater range of motion than the human wrist and eliminates the possibility of hand tremor, resulting in precision and maneuverability that would be impossible with traditional laparoscopic procedures.
The biggest benefits that I see for patients are less blood loss, less pain, less problems with infection, and faster recoveries. Patients are in and out of the hospital sometimes in less than 24 hours, and they hardly use any pain medicine and not near the narcotics like before, and their recovery is much faster. They're back in life with no delays.
Open procedures are very invasive. It takes weeks for them to recover, where robotic surgery, they're up quicker, they feel better faster, just get along better altogether.
At present, only 20% of women have access to robotic surgery. But with such important benefits on the line, both doctors hope more women will become aware of this option and seek out a surgeon who is highly proficient in the technique.
It's always important for a woman to be her own advocate and very aware of options. One of the most important options that a woman should consider is minimally invasive surgery. A second opinion regarding robotic surgery is always important. 2 things that I would always consider is 1, how qualified is your surgeon? How many procedures have they done and how well trained are they? The second thing that is equally as important is how well do you get along with your surgeon? Because after all, your healthcare is all about you.
My experience was fabulous. I had the surgery on a Friday afternoon. I went home that night. I was only off for the following week and I was back at work right after that.
Open surgery is quickly becoming a thing of the past. As more doctors become skillful in robotic surgery, it's hopeful that more women will have easier access to this highly beneficial technique. As the first gynecologist in Wisconsin performed Da Vinci robotic surgery, Dr. Herb Cousins is one of the pioneers in gynecological robotic surgery in the country. Dr. Cousins and Dr. O'Toole have conducted hundreds of successful robotic gynecological procedures, including hysterectomies, since 2005, and are staunch advocates for this cutting-edge surgical technique.
This is the best way to offer surgery for women. Because it's not as widely accepted or available across the country, it's important to me to promote the technology to women and educate women about their options. It's interesting because in the very beginning, when I mentioned robotic surgery, patients looked like it was some sort of science fiction thing. But once I explained to them that it's really for their benefit, that from their perspective, they go to sleep, they wake up with Band-Aids, they go home in a day, they understand it completely. And they understand laparoscopy. This is just a different tool to perform laparoscopy.
It was a positive experience for me. I had a little pain after the procedure. It was a 1-day procedure, so it was a short stay. And I felt the recovery was fairly simple.
Dr. Cousins is committed to educating other physicians and patients about the benefits of robotic surgery.
I spend part of my time teaching other surgeons. We run a case observation course here where surgeons from around the country come to learn advanced skills, and then I have the ability to travel to other locations and teach surgeons as they do their first cases with the robot. I've practiced around the country. And I also utilize most of the hospitals in Green Bay, and I enjoy coming to Bellin because the nurses work so hard to make things good for the patients as well as the staff and the physicians. Bellin was the first in this area to adopt robotic surgery as a technology. They've been very committed to growing the program to the point that now we have the latest equipment, 2 robots, and a dedicated team for robotic surgery.
Because robotic surgery reduces length of hospital stay, it not only benefits the patient, but also our healthcare system. Traditional open procedures require extended hospital stays and the cost associated with it, but many say it's not necessary in most cases. In fact, less than 1% of all Dr. Cousins and Dr. O'Toole's procedures are open.
It is difficult to talk to administrators and convince them that the equipment is a good purchase. But what we've seen at Bellin across all 4 specialties are cost savings to the hospital, and that gets passed on to the patient in many instances. It becomes less expensive to do the cases because patients go home quicker. They're not in the hospital 3 days, 7 days. They go home in a day or 2, and they go back to work quicker, and that provides, less cost to the healthcare system.
Dr. Cousins is dedicated to making sure all of his patients receive the highest quality of care and is leading the way to make robotic surgery available to all women across the country. To schedule a consultation or second opinion with Dr. Cousins or Dr. O'Toole, visit DaVinciGynecology.com or call the number on your screen.